I'm Jessica Bonish, and I became interested in improvement work after being a patient on the mental health unit. When I was getting admitted to the mental health unit, it was extremely distressing. And my parents weren't allowed to stay in the room with me, and we had to really push, which when you're emaciated and can't stand, that shouldn't happen. And finally, what got me admitted was my mom saying, like, she's not a medical emergency necessarily now, but do you want us to bring her back in a couple weeks on a stretcher or dead? So that's really the final straw that got me admitted, but it was about 3 or 4 hours of fighting, which somebody with a mental illness does not have that fight in them. And I was with my parents, so they really advocated for me. Had they not, I am positive that I'd have severe complications or may not have survived. I've done a few RPIWs. My first one was actually looking at admission to the mental health unit, so that fit perfectly. And we were able to come up with a sheet for psychiatrists to fill out, so it was a standard process and not everyone having a different process to assess clients. And then we also standardized when psychiatrists would come, hoping to reduce the wait time for people in the waiting room and also who have a bed already in the emergency room. I think it's important for collaboration to occur because quite often everyone is in their own little corner and everyone has concerns, and there's often bureaucratic processes that you have to go through to make any changes happen. But once everyone gets together, we often realize that the administrators, the frontline staff, and the patients and families all have the same concerns and have many of the same ideas, and the improvement work allows for those changes to happen quickly.